Good afternoon. I call this hearing to order. A quorum is present. Without objection, the chair is authorized to declare a recess at any time. Before we proceed, I would like to go over a few housekeeping items for our remote hearing. First, if you are experiencing connectivity issues, please make sure you or your staff contact our designated technical support so those issues can be resolved immediately. Members participating remotely must continue to use the video function for the duration of their participation in the hearing unless they experience connectivity issues or other technical problems that render the member unable to fully participate on camera. It is the committee and the subcommittee policy that members will remain muted when not recognized, just like turning your microphone on and off during an in-person hearing. This is out of courtesy to all members on the subcommittee, and so that background noise does not interfere with another member who is recognized to speak. When you are recognized, you will need to unmute your microphone and pause for a couple of seconds before speaking so that we will be able to hear everything you say. In order to ensure everything members say is captured on the live stream of this hearing, I ask that members pause for 2 to 3 seconds before beginning to speak. If you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteransaffairs.hearings@mail.house.gov. It will be uploaded to the committee document repository. Without objection, members will be recognized in order of the subcommittee seniority for questioning witnesses today. This will make it easier for me to ensure all members participating have an opportunity to be recognized. Does any member have a question about the procedures for this hearing? Hearing none, we shall proceed. I recognize myself for an opening statement. Today, the subcommittee will review the VA's progress with modernization and security, their IT infrastructure. Given the current spotlight on physical infrastructure with the Senate's bipartisan infrastructure bill and our committee's recent successful markup to provide $18 billion to invest in VA's aging facilities, I feel it's important to also focus on VA's IT infrastructure. I'm hopeful that current plans to increase broadband access to rural areas to help close the digital divide and increased funding for technology modernization will provide improved and increased access to care for all veterans. I also don't want to lose sight of the importance of strengthening the security of these programs. In May, the subcommittee held a hearing to examine VA cybersecurity efforts, and we reviewed cybersecurity spending by VA in our July hearing on their IT budget. For good reason, I am concerned about VA's ability to protect the information of veterans as well as its ability to ensure there are no disruptions in service. In June, the VA Office of Inspector General released an audit on the Austin VA Outpatient Clinic and disturbingly found that VA was able to identify less than half of the components connected to the system. Without visibility and up-to-date inventory of IT components, securing these systems is impossible. While VA focuses on the infrastructure readiness program and their efforts to reduce the current technical debt, ensuring that visibility of these hardware components and coordination from the OIT with medical centers across the country is paramount to securing IT systems. VA has historically struggled to successfully manage IT programs. In 2015, VA's management of IT acquisitions and operations were added to GAO's high-risk series and remain there. The committee has received encouraging updates on the effort to modernize VA's financial management system. However, the new financial system cannot exist in a vacuum. The success of that modernization is contingent on a successful update of the electronic health records and supply program. It is up to the CIO to make sure that the technology behind these communicate with each other and are secure. I look forward to hearing from our new acting CIO, Dr. Evans, to provide some insight on his plans to get VA on a successful path forward. I thank the witnesses for being here, and I look forward to their testimony. At this time, I would like to recognize my colleague, Ranking Member Rosendale, to deliver any opening remarks he may have. Mr. Rosendale.
Thank you, Mr. Chair. Appreciate that. I appreciate our witnesses joining us today from the VA Office of Information and Technology. Only 2 months have passed since our last hearing, but already we see new faces. Dr. Evans, I want to thank you for your willingness to step in as Acting Secretary and Chief Information Officer. Do appreciate it. In the business world, it's often said that an organization standing still is falling behind. And we're all familiar with Moore's law that computing power doubles roughly every 2 years. VA cannot afford to stand still. Operating under an acting chief information officer is no excuse to tread water. In fact, acting CIOs are more than the rule than the exception at the VA. And on average, they only serve for about 10.6 months. I hope we are not making you nervous, Dr. Evans. The previous acting CIO was in place for 8 months. Dr. Evans, that means you will probably be with us for a while anyway. Information technology has nothing to do with ideology or party. It's about results. In VA's case, it's about continually improving the quality and accessibility of care and benefits for our veterans. I know government bureaucracies tend to value titles and they resist change. Senate confirmation confers authority. However, it would be unacceptable to merely keep the seat warm until the administration puts forward a nominee and the Senate gets around to acting on it. So we have high hopes for you, Dr. Evans. VA is in the midst of the biggest technology modernization drive in its history. The department is continually growing and creating new IT requirements faster than anyone can imagine them. The overall VA budget grows by leaps and bounds every single year. That puts the IT budget at about $5.6 billion. And while it must accommodate growth at the VA, blindly throwing money at a problem will only compound it. We have to direct resources to the areas that produce demonstrable results, not flashy projects that continually spin our wheels. Our witnesses are well aware of this. My goal today is to give you a platform to lay out a practical agenda in line with the strategic goals that already exist. I want to hear about the key initiatives you intend to accomplish in 6 months, 9 months, or a year. I also know that not everything can be completed in those timeframes. It's equally important to build up the organization's capability to plan and execute projects. Leaving OIT better than you found it would be an accomplishment on its own. I want to maximize our time for questions, so I will not belabor these points. I commend the chairman for his foresight in organizing this hearing at this time. A new chief information officer presents a tremendous opportunity for us to revisit some of these old problems so that we can hopefully address them. Mr. Chair, I appreciate your accommodating this, and I would yield back.
Thank you, Mr. Rosendale. I will now introduce the witnesses we have before the subcommittee today. Dr. Neil Evans is the Acting Assistant Secretary for Information and Technology and Chief Information Officer for the Department of Veteran Affairs. Dr. Evans is accompanied by Mr. Todd Simpson, Deputy Assistant Secretary for Development Security Operations, and Mr. Paul Cunningham, Deputy Assistant Secretary for Information Security and Chief Information Security Officer, and Mr. Charles Worthington, Chief Technology Officer for the Department of Veterans Affairs. We will now hear the prepared statements from our panel members. I will remind you to please pause for 2 to 3 seconds before speaking so that the recording will capture all of your words. And please remember to do so when answering members' questions. Thank you. Your written statements in full will be included in the hearing of record without objection. Dr. Evans, you are recognized for 5 minutes.
Thank you. Good afternoon, Chairman Mervin, Ranking Member Rosendale, and distinguished members of the subcommittee. Thank you for the opportunity to speak today about VA's effort to modernize and secure the department's information technology infrastructure. VA continues to deliver on its mission to provide healthcare and benefits to veterans, their families, and caregivers. Across VA, information technologies are optimizing communications, enhancing workforce efficiency, and empowering data-driven decision-making. With the rapid acceleration in technology-driven solutions and innovation in the marketplace, VA's digital infrastructure needs to be continuously updated to current standards and requirements. The Office of Information and Technology is working in partnership with the rest of the department to modernize and transform the digital aspects of VA. This is no easy feat, but one we are absolutely committed to. As a practicing VA physician at the Washington, D.C. VA Medical Center for the past 20 years, I have firsthand experience with VA's information technologies, and I understand the impact that access to up-to-date, reliable IT capabilities can have for our frontline staff as they serve our nation's veterans every day. Technology is at its best when it seamlessly enhances the connections between VA team members and the veterans they serve. For example, during the pandemic, VA leveraged its technology investments and pivoted to a predominantly virtual environment. As a clinical end user, I experienced firsthand how VA's investment in telehealth technologies, veteran-facing digital health capabilities, conferencing solutions, and remote access capabilities allowed services to continue at scale and drove real-time innovation throughout the pandemic. VA's ability to react with agility and to deliver this type of experience for both veterans and VA staff is dependent on our IT foundations, including VA's network, communications infrastructure, medical devices, data systems, software applications, cybersecurity, our strategy there, and more. We're grateful for the support of Congress as VA continues and is committed to this modernization journey. A relentless focus on the user of VA technologies, whether that be a veteran, their caregiver, or a VA staff member, is my top priority. VA's digital transformation strategy includes 5 imperatives: exceptional customer service, IT modernization, strategic sourcing, seamless and secure interoperability, and workforce transformation. In support of these imperatives, we're focused on several key areas from a technology perspective, including data management, migrating applications to the cloud, improvements in cybersecurity, digitizing key business processes, decommissioning outdated legacy systems, and recruiting and retaining a world-class IT workforce. I will briefly highlight a few key portions of this strategy and the results we are seeing, and then we look forward to your questions. First, our digital veteran experience strategy. On average, over 11 million unique users per month have at least one digital interaction with the VA. 1.3 million of these users log in to VA's digital healthcare tools, which are among the most used and well-liked in the healthcare industry. Since 2018, VA's digital experience strategy for veterans has been to unify their experience across business lines, allowing veterans to manage their VA healthcare, community care, disability benefits, education benefits, debts and payments, and other VA information through a single experience on va.gov and forthcoming flagship mobile applications. This strategy is paying dividends. Since the launch of va.gov in November of 2018, customer satisfaction with VA's online services has risen 20%, and the use of VA's self-service tools is up over 50% in many categories. Second, infrastructure readiness, a key component of IT modernization. VA's infrastructure readiness program, established in fiscal year 2019, guides the ongoing refresh and replacement of the IT infrastructure that sustains all VA IT operations. By managing technical debt and providing common core technology elements that remain within their useful life cycle, we can better support continuous readiness and enhance VA's security posture. To date, VA has achieved a cumulative reduction of approximately 10% in technical debt across common core technologies, including end-user devices, internet bandwidth, and communication capabilities. And then finally, cybersecurity. As you mentioned, protecting the department's information resources is a critical priority, which includes safeguarding veteran information in the systems that store, process, and transmit that data. We're leveraging a balanced risk managed approach to doing so. And this remains a critical priority. Information technology is a key mission enabler for the Department of Veterans Affairs, and we are absolutely committed to continued modernization in the service of America's veterans. Thank you again for this opportunity, and we look forward to your questions.
Thank you, Dr. Evans. I will now recognize myself for 5 minutes for questions. Dr. Evans, in the Infrastructure Readiness Program plan provided to the committee, you forecast carryover technical debt being eliminated by fiscal year 26. This is dependent on the increases in the IRP funding of 8% in fiscal year 23 and over 5% increase in funding each fiscal year after through fiscal year 26. How does the VA plan to pay for those increases?
Well, first, with regard to the infrastructure program, it is critical for us to minimize and lessen our technical debt. And as you mentioned, this is an investment that we are making that will pay long-term dividends in increasingly securing the network and making sure that our VA staff have access to the technologies that they need. One of the challenges that we face is that we have a large and complex network. Some of the gains from our early investments in infrastructure modernization to include investments in infrastructure modernization that are also supporting our electronic health record modernization program should hopefully help us accelerate that progress. But I think I'd like to ask Mr. Simpson if he has some further thoughts on this question as well.
Thank you, Dr. Evans. I would say that by building the funding into the base budget and continuing to allocate the funds into the IRP is the only way that we're going to attack the $1.3 billion worth of technical debt that's currently part of the IRP. It's got to be a persistent effort, and it's going to take a disciplined, steady approach to do that.
Okay. My next question, if I may, the OIG report from the Austin facility faulted the VA's inventory of the assets, calling them poor and inaccurate. Given this description and that the problem is nationwide, is this a realistic projection?
So with regard to the OIG report, I'm going to ask Mr. Cunningham to start to answer this question, and I may have some further thoughts.
Thank you. The department has approximately 1.4 million endpoints, and the inventory of those are across several inventory databases. So in management of those, there's a challenge there, and we're definitely working on developing a more seamless way to inventory our equipment, and then to share that information when we do have assessments, as was the case with the IG. There was a little bit of a cross-pollination of data. So is it a fair assessment that we can do better? Absolutely. Is it a fair assessment we don't know where all of our equipment is? I don't think that is truly a fair assessment. And along that way, I would also state that the efforts that we're putting into modernizing is part of that, increasing the fidelity in our ability to manage and track and avoid the double counting of equipment.
Mr. Cunningham, if I may follow up, if you can kind of deep dive on not a fair assessment, kind of elaborate on your thoughts on how that you feel that not being able to accurately find or locate that equipment and how the inspector general may have came to that conclusion.
Well, let me try to find a better choice of words in that regard. We work closely with the IG. They gave us a scope that they were going to work with. We provided them the IP spaces of that scope. when they did scan, they saw additional equipment based off of how they were scanning. We went back, we did talk to them about that scenario in on the hot wash, and we recognized that we could be better at providing the scope of scans and networks that they were looking at in a more graceful way in the future. So we do take ownership of our network, and we do take ownership of where our equipment's at. However, in this case, there was an issue about what we thought they were looking at and what they were going to go look at. Does that help clarify the?
It does clarify, and my only perspective is as a past elected official, when we came and got audited, we had to have all of our property ready and prepared, and we knew the audit was coming. And there usually wasn't a misinterpretation of what was to be audited and what was not to be audited. But in the future, obviously, those are things why we're having this hearing, to knock out those kinks, because then we are able to determine the infrastructure that we truly have or the infrastructure that we do not truly have. And so that audit is primarily one of the reasons why we're here. So with that, I'd like to I also want to say I realize updating laptops and servers may not be the most exciting topic of discussion. It's very important to the success of your modernization efforts at VA and to the security. I want to make sure that in the next year's budget request, VA is providing us with the most accurate information on what we need to relieve the technical debt so that we can start spending less on legacy systems and technology and more on technology that's going to provide better care for veterans and safeguard their information. So ultimately, that's the statement. With that, I'd like to recognize Mr. Rosendale for 5 minutes.
Thank you, Mr. Chair. Mr. Evans, I'm going to focus more on going forward, Dr. Evans, than some of the behind us issues that you don't have obviously too much control over. The worst thing for OIT to do would be, just as I stated in my opening statements, just to tread water until a new assistant secretary is confirmed. So what are your goals? What have you lined out to achieve as the new head of this OIT during the interim?
Thank you, Mr. Rosendale. So let me just say this. As you noted, every single day, more than 350,000 VA employees are coming to work to serve America's veterans, and millions of veterans are depending on the VA, and it's our obligation to serve them. As I mentioned in my opening statement, at the top line of my strategy and priority scheme is focusing relentlessly on the needs of our users. Increasingly, technology is a part of how we in society access resources, how we connect with, and certainly for the VA, technology is at the core of how we deliver information to decision makers to support the administration of benefits, how we get information to the front lines of the clinics, how we help veterans connect with VA to connect with the benefits that they have earned and to receive the healthcare that they need. And when we focus on the needs of the user, whether that user be a frontline clinician, whether that be somebody in the Veterans Benefits Administration who is adjudicating benefits applications, most importantly, when that user is a veteran or their caregiver or somebody involved in the care of veterans, our information technologies should be designed to provide, frankly, delight. We should be delivering experiences that are consistent with our vision of what a modern VA should look like.
So all that being said, okay, yep. I cut straight to the chase, and that was a lot of pillow stuffing, quite frankly. It sounds nice, it's fluffy, and it's all conceptual and subjective. What I'm trying to find are what are the specific goals that you really are laying out to say, this is how we are going to complete, hey, this is how we are going to deliver all of those, wonderful promises that you were just talking about?
Yeah, absolutely. So first, we focus on the digital veteran experience. As I mentioned in my opening statement, since 2018, we've been committed to a digital veteran experience journey. And I think we need to continue to press forward with that. That means delivering through va.gov and soon to be launched flagship mobile applications, a place where veterans can go to interact with VA, to transact with VA, and they don't have to understand the inner workings of VA in order to interact with us online and digitally. Second, it is providing a reliable infrastructure. It is this, what we're talking about here in this hearing. It is about doubling down on reducing technical debt, delivering reliable infrastructure so that VA employees have access to the data and the information that they need, right? This is sort of foundational infrastructure that keeps things moving. And it is creating and moving towards delivering platforms that allow us to, with agility, deliver new capabilities faster when those are necessary. I think we've learned a lot from the pandemic that we grew, frankly, 10 years in 18 months when it came to how we responded to the pandemic. And taking some of those lessons learned, a priority for me would be to say, let's look at some of what we learned over the last 18 months and learn about how we can apply that moving forward.
So with that being said, have you been given the authority from the secretary? Have you been given the mandate from the secretary to go ahead and aggressively pursue this agenda?
Yes.
Okay, very good. All right, Mr. Chair, I'm down to 10 seconds, so I'll go ahead and yield back to you.
Thank you, Mr. Rosendale. At this time, I'd like to recognize Chairman Takano. Chairman Takano, you are recognized for 5 minutes.
Thank you, Chairman Ravan, and thank you also, Ranking Member Rosendale. I appreciate the going beyond ideology and trying to just deal with a very technical subject. Dr. Evans, I want to thank you for your testimony and your service to VA, specifically during the last 18 months with your work leading the Office of Connected Care at VHA. I think it's important as we move forward that we don't lose sight of the lessons that we've learned from dealing with a global pandemic, which we are still not completely out of. And even, let's be fair, even before the pandemic, there were issues with what I'm going to talk about, which is our supply chain issues. The flaws in VA's ability to track and obtain medical supplies during the pandemic highlighted the need to modernize VA supply chain. So it was a problem before spanning administrations. I will say that my experience as chair during the pandemic, that VA was also not immune to, I think, the lack of coordination of acquisition of PPE and other medical supplies that basically states and other entities and private hospitals. I just felt, the previous administration just did not grasp the need for real coordination and presidential leadership. So we owe it to veterans and staff at the VA to get them the supplies that they need when they need them. So Dr. Evans, what exactly is the current status of VA supply chain modernization and the planned transition to DIMLs?
So first, when I'm in clinic, it is important for me to be able to reach into the drawer that is next to me and find the supplies that I need in order to effectively care for patients. So I really understand how important our supply chain efforts are. This is an area that is a high priority. As Mr. Rosendale mentioned, another area that I would say would be a priority is our major transformational initiatives, our supply chain modernization, our financial management system modernization, and electronic health record modernization, 3 very critical areas for VA. With regard to our supply chain, I'm going to turn to Mr. Simpson for some of the specifics on where we stand. This is predominantly run by our supply chain team. IT is here and fully committed and will, under my leadership, be absolutely fully committed to driving supply chain modernization. It is an absolute critical priority for our organization. Mr. Simpson.
Right.
So in July of 21, there was a U.S. Court of Federal Claims decision that prevents the implementation of DIMLs beyond VISN 20 and the Captain James A. Level Federal Healthcare Center. We are planning a DIMLs deployment scheduled in VISN 20 during the mid-second quarter of 22. Our main focus with DIMLs is obviously to support the common core technologies that enable a successful DIMLs implementation. We're focusing on a DIMLs cloud enclave that is going to provide testing and training capabilities to practitioners and users. And that's really where most of our emphasis is right now in our DIMLs journey.
Okay, well, let me just list that. So how many sites are currently using DIMLs? 2?
Yes, there are currently
two sites are currently using DIMLs. You're planning to transition to the third. And you're saying that the recent Court of Federal Claims opinion on VA that bars VA from transitioning to using DLA's medical surgical prime vendor contracts affects the implementation of DIMLs. Is that the court ruling that you're referring to?
Yes, sir.
Well, how has it affected? Is it slow? Has it slowed the rollout? What is it? What is the real impact of that ruling?
So I believe that it actually restricts us from moving beyond VISN 20 and from the Captain James A. Level FHCC at this time until the decision is overruled or there's another decision made.
Okay. Well, I know this is all distressing. Chairman Mervan, before I yield back, let me just say that for me as chair, that modernizing VA supply chain system is a high priority for me. And it does not appear that things are going well with the supply chain system, even with the extra CARES money that we provided. So I got to tell you that failure to modernize the system is not an option. And I know that Dr. Evans, you're new to your position as acting CIO, but this is a priority, and I hope that you all will focus in on it. And I realize that this is a long-standing problem, but we've got to get our arms around it. I yield back, sir.
Thank you, Chairman Cano. At this time, I'd like to recognize Representative Jim Banks for 5 minutes.
Thank you, Mr. Chairman. Dr. Evans, it always seems like OIT is nowhere to be found when VHA technology projects that directly impact veterans go off the rails. One recent example is the software that veterans use to apply for beneficiary travel. Many veterans in Indiana are still frustrated with it. What is OIT's role in fixing that particular system?
I don't know the answer to that. I would be happy to take that for the record. I understand that the beneficiary travel, I know the beneficiary travel system, it is important. My veterans in clinic use that system all the time. I clearly need to look into that in this new role.
You'll get back to us for the record.
Absolutely.
Dr. Evans, VA has extremely long timelines for many of its IT projects. 5 and 10 years is common. Sometimes that's unavoidable, but length increases risk. What is a reasonable time period to implement a new software application in your best opinion?
I think it depends on the complexity of the software application, but perhaps more importantly, it depends on the change management that is necessary or the business process transformation that the new software system requires. So for example, when we consider electronic health record modernization, there is a significant element of change management, training that is necessary, business process reengineering and rethinking how we deliver, how the software can support our delivery and care. And that necessarily increases the timeline for the implementation of the technology. With regard to the technology itself, one of the reasons that IT has been transitioning to a DevSecOps model is to assure that our teams who are doing the development of new applications, those that are running the operations of those applications, and those that are responsible for securing the operations are all working together in concert with an agile mindset, delivering new code every 2 weeks in order to deliver software faster. It's part of our DevSecOps digital transformation. We are seeing significant results. I will give you a quick example. At the beginning of the pandemic, we recognized, or as we were coming online with bringing vaccines to veterans, we recognized that we needed to more quickly allow veterans to sign up for vaccinations. And we were able to, in something on the order of 2 to 3 weeks, configure our vet text platform to allow veterans to request their vaccinations online and book their vaccinations online. And in fact, I think we've now scheduled more than 230,000 vaccine appointments by vet text, again, to the delight of veterans. And so that was delivered in frankly several weeks by building on a core platform and configuring new capabilities. That's what I want to see when it comes to delivery of capabilities for VA. That's part of what we're going to push for in OIT.
5 years ago, OIT adopted the strategy to buy first, meaning to stop building software internally, but its meaning has become unclear. VA frequently purchases commercial software only to customize it extensively. It is also true that many companies sell platforms that allow you to quickly build applications without writing a lot of software code. What does, in your opinion, Dr. Evans, buy first mean in 2021?
Buy first means the following. When we are software as a service is another term for an application that where we are essentially purchasing an application with no intent to do significant customization because it meets VA's needs out of the box. This allows us to deliver new software capabilities faster and frankly helps us from a security risk standpoint and management and reduction of technical debt. For use cases where a commercial software as a solution package meets VA's needs, this should be our first choice. You mentioned platforms that can be configured with low code or no code. That is where we can get a platform in place that we can then configure. For example, the text messaging solution I just mentioned would be an example of that. We already had a platform. Within a couple weeks, we could deliver new capabilities. So we're already seeing, we've mentioned this buy first mentality. We're executing on it. We're seeing positive results from it. And we will continue in that journey. There will always be places where there's a need for custom code because of VA's unique mission, but we should make sure that we are careful. And part of our strategic planning within IT is assuring that we are minimizing the number of custom applications that we're supporting over time to those that are mission critical.
Okay, my time has expired.
Thank you, Mr. Banks. At this time, I will recognize myself for 5 minutes. We received some updates on the restart of the EHRM program from the Deputy Secretary, and we have invited him to a hearing in October to discuss progress after their strategic review. While I will reserve my comments regarding the management of that program for him, I would like to hear how OIT is being impacted by the delays with the EHRM. Dr. Evans, As the CIO, do you feel sufficiently involved in the decision-making process for the continuation of the go lives with the EHRM program?
Yes.
Can you
I do.
elaborate on that?
Sure. Yes, certainly, EHRM, the electronic health record, is an information technology system. It needs to run on our network. It requires upgraded endpoints. It requires sufficient internet bandwidth for the solution to work with low latency for our providers on the front line of care. And it has capabilities that directly face veterans as well. So there is a technology component to that project. IT is very involved with preparing our sites from an infrastructure perspective, working closely with the Office of Electronic Health Record Modernization and with VHA, whose employees will be the users of the system in determining next steps. So we are very involved in all of those discussions. And frankly, it is a high priority of IT, certainly under my leadership, that we are supporting the continued forward progress of the electronic health record modernization project in VA.
As a practicing physician, have you gone through transitions of electronic medical records in the past?
Well, 20 years ago, when I left Johns Hopkins and came to VA, I left what at the time was a very sort of nascent early electronic health record at Hopkins that they're no longer using, and began to use CPRS, our current electronic health record, with VIST as its underpinning. And so, I had the experience of having to see patients and learn how to use new technology, how to efficiently operate. But having said that, I've not experienced a change from a modern commercial electronic health record to another modern commercial health record, although I have many colleagues and have spoken to many folks who have gone through that, right? And a lot of this, as I mentioned earlier, is about providing adequate support to the users on the front line to make sure that we are making good decisions about how we configure the record to support workflows at our facilities, but then to really help users learn how the new system will bring value to their daily operations. And again, as I mentioned earlier, to be very careful to listen to the user as we continue to improve the product.
What are the risks posed to the programs that are directly under your responsibility, like the FMBT and the supply modernization, if EHRM continues to have issues moving forward?
First, I'd say that for FMBT, for supply chain modernization, for EHRM, these are all shared efforts that we own together within VA. None of these programs succeed based on IT's efforts alone. The success of the programs will depend on the collaboration of VHA, of the program office that is managing the implementation of OIT. On top of that, all three systems have interdependencies with each other. And so it is our responsibility as senior leaders within the department to work together to make sure that we are integrating and coordinating those efforts. And those are discussions that I know I am very regularly involved with, and my team is very regularly involved with in thinking about how do we continue to move forward together and coordinate what are three massive transformational efforts at the same time.
If I may, in your opinion, what do you think the best path is, or the transition from going from facility to facility to an enterprise-wide transition for the electronic medical records? How do you think that would be best rolled out?
We're having many conversations on that topic, as you're well aware. I think it is important to recognize that change is a labor-intensive process, and it requires us to spend considerable time with frontline staff, for example, with the EHR, of every stripe, cardiologists, social workers, nurses, laboratory technicians, the folks who are managing the finances in our medical centers. It's every single community in our medical centers who need to identify how the change of the new electronic health record is going to impact their daily lives. It's my belief that we will learn from future deployments, and we will pick up momentum as we move through this this process. But right now, we're still in a learning mode at new medical centers as we go live. And we have an opportunity to really take the lessons learned from some of these early implementations and then revisit how can we pick up the pace? How can we assure the white glove hands-on help that frontline clinicians and medical center administrative staff, et cetera, need to succeed and to deliver that with an increased velocity.
Thank you, Dr. Evans. At this time, I'd like to recognize Ranking Minority Member, Mr. Rosendale, for 5 minutes.
Thank you, Mr. Chair. Dr. Evans, as leaders and managers, the most valuable commodity that we have is time. I mean, it really is. And what I'm trying to determine is how can you devote the necessary time to this position when you also continue to head the Office of Connected Care in the Veterans Health Administration?
The Office of Connected Care is currently being led by Dr. Kathy Frisbee, and I have absolute full confidence in her ability to effectively lead that office. I have ceded the leadership of that office to her. And in addition to Dr. Kevin Galpin, who is the Executive Director for Telehealth, 2 individuals in whom I have the utmost confidence.
Very good. Dr. Evans, I also understand that you're a physician who continues to treat patients here in Washington. What was your impression of OIT when you were one of its customers?
So for 20 years, I've been a customer of OIT. And I have to say, I mentioned earlier the word delight. A couple months ago, before I was the CIO, I was in clinic seeing patients and my keyboard started to stick. A couple keys stuck on the keyboard. I think it had been cleaned overnight by some kind of cleaning solution, and it wasn't quite working right. I could work, but I wasn't typing notes as quickly as I needed to. Things weren't quite working. And I went into the Your IT system, which is our online help ticket. I didn't actually call the help desk. I just put in a request for new equipment. Literally 14 minutes later, probably, it was no more than 15 minutes, 15 minutes later, somebody was at my door handing a keyboard through in the middle of a clinic visit. That's the kind of experience that we need to be delivering. And it was absolutely a thrill to get that kind of customer service from IT staff who recognized that the ongoing delivery of clinical care was a priority and required an immediate response.
So I can tell you that is not the experience that we typically hear, okay, throughout the Veterans Administration. So either
It's
they
not the-
they either discovered that you had just been appointed as the acting secretary, okay, because it ain't because you're purty, as we say around my house.
Right. Well, listen, I agree. And I guess my point is we can, in IT, when we're serving our customer, we can delight our customer. And that's what I want to see happen across the enterprise. Is it uniformly happening? No, probably not. And sometimes technical problems are thorny and are hard to solve. But I will, we answered last year, if I recall, I think it was 6 million trouble tickets over the course of the year. And I think it was 85% of the time they were resolved on first contact. And so we're seeing increased customer satisfaction when we survey our employees. We are seeing increased satisfaction with IT. Is there room to improve? Always there's room to improve. But this is what an IT organization should be doing. It should be delivering high quality customer service to those who reach out for help.
So when the pandemic really hit it seemed like its apex last year, I was still the insurance commissioner for the state of Montana. And so I was right there at the crux between the delivery of healthcare and insurance, and all of it was wrapped into one. And we had to, like many people, start delivering our services from remote locations. And you were speaking earlier about some of the things that you learned as you went through the pandemic. So what I would like to hear is some of the, again, I like to hear specific, what are some specific things that you learned that you feel like you're going to be able to bring forward and implement at OIT?
Yeah, well, I mean, you mentioned the shift to virtual. Just to give you a sense, even now, just 2 days ago, there were 104,000 VA users who logged on remotely to the network through one of our technologies, and another 18,000 who logged on through another type of technology. So that's 118,000 individuals who were able to effectively access VA resources from potentially their homes or alternate work sites and deliver services to veterans. That has required a significant investment from the IT support perspective, the infrastructure, et cetera, to do that. With regard to telehealth, as an example, we went from doing on average 2,000 telehealth visits to the home prior to the pandemic to now more than 40,000 on a typical workday. Significant changes, almost all of which were undergirded by a technology that drives our movement forward.
Thank you very much. And Mr. Chair, I see that I'm over, so I yield back.
Thank you, Mr. Rosendale. At this time, I'd like to recognize Chairman Takano for 5 minutes.
Thank you, Chairman Ravan. Dr. Evans, there seems to be a number of decision makers involved in IT modernization, procurements, and management, especially where those procurements will require interaction with new enterprise systems such as EHRM. Can you please walk the committee through the coordination between OIT and VHA and OEHRM regarding procurement and the management of these programs?
Sure. As the CIO has responsibilities under FITARA to review and approve IT acquisitions for the department. And we have instituted processes within and trust me, I'm new to my role, but the first day, my orientation was what my FITARA responsibilities were as the incoming CIO, how the rigor through which we evaluate acquisitions and review those and approve those within IT, which is a critical part of making sure that we are rationalizing our IT investment. With regard to decisions about then, so that's part of the acquisition. Now, you asked about how do we coordinate, for example, with regard to EHR modernization. As you're aware, the Deputy Secretary is leading the effort and assuring coordination of the key stakeholders across the enterprise. And so we regularly engage. I meet regularly, and my team meets regularly to assure that we are driving, that we're making decisions together, and that we are speaking with a unified voice as we work alongside of senior department leadership in identifying our path forward.
Well, I realize that you're new to your job and you're going to briefings about it. But my goal is to determine whether the current management structure at VA is effectively coordinating to ensure that we're entering into agreements with the highest degree of confidence for success. So as you settle in, I would like, I'd be happy to have you take this question again for the record, so you can maybe get back to us in greater detail and maybe provide a briefing to my staff, because this has been a critical issue in terms of how VHA and OIT are related to, the coordination between the two, I think has been an issue. Hiring qualified technical staff has long been a struggle for VA, and especially in locations like Seattle and Silicon Valley, where technical experts can make considerably more outside of the VA. Is staffing sufficient within OIT to meet VA's needs nationwide?
So I think we, with regard to the workforce, we need, frankly, a full court press on making public service appealing to technical experts. I completely agree with you. With regard to,
can you give me an idea of how many vacancies that you currently have? I mean, if that's you don't have it, you can always get back to us on that.
Yeah, I may need to take that for the record, although I don't know whether Mr. Simpson may have some.
Well, I mean,
otherwise we'll just take it for the record.
Yeah, I'm going to want to know just what Congress needs to do to help you fill these positions. I just want to let you know that I've also asked the previous CIO about staffing needs at OIT, and I'm serious about it. If you're having issues with getting qualified technical staff to support these billion-dollar programs, I want to know about it. Some of these IT programs are on their third and fourth modernization attempts, and we cannot continue. We cannot have failure is not another option. It's not an option. Now, given the difficulty VA has hiring federal employees who are qualified for these technical positions, it is commonplace across the government to supplement the government workforce with contractor staff. And while I'm supportive of hiring subject matter experts in the IT field to manage these large programs, I'm concerned that we may be too heavily reliant on contractors to do the work that federal employees should be doing. It's important that we are investing in our workforce and keeping the institutional knowledge and expertise within VA. Mr. Chairman, I was going to ask if we could get an understanding of to what extent is VA dependent on contractors for staff augmentation, but my time has run out. So I know we're going to call it for vote soon, but I yield back.
Thank you, Chairman Takano. I now would like to recognize myself for 5 minutes. Mr. Paul Cunningham, from our previous hearing on fiscal year 22, VA IT budget, we know shadow IT is a problem. What specific tools is VA using to understand the size and footprint of the shadow IT?
Thank you. And first, if I can go back and make a clarification statement around your comments around the IG report. I want to recognize that VA recognizes that it's our responsibility to provide timely and accurate information to OIG for them to do their job. In that regard, OIG did their job with the information that we provide them, and in that case, it is a fair assessment based off what we gave them. And I appreciate your comments earlier. We'll take those to account for the future. On shadow IT, I work very closely. The Office of Information Security works very closely with DevSecOps and operations team to identify, to scan, to identify rogue systems, as well as any sort of assets that are on our networks. And then also work with our business owners to understand that when they buy something and they put it on our networks, even if it's allotted inside the access that we're giving them, that they have to report that information to us so we know where those IT assets are and how they're being managed. This is a stronger issue around it's a stronger issue around our partnerships with VHA, VBA, and NCA, in that when they buy an application, especially when they put it on our networks, we need to understand the business implications behind that. And then what are they doing to make sure that they're monitoring the logs that show that the business processes are accurate and not allowing unauthenticated or unauthorized use of their networks.
So for Mr. Evans, we asked this question of your predecessor, Mr. Cassatt, but I'm going to ask you as well. Do you have a current estimate of how many shadow IT programs are not reflected in your current information technology budget?
I do not. I will say this, that I think my sense is that I come from VHA, so I know quite well what is happening across VHA, and I struggle to know, for example, where there would be shadow IT that we were not aware of. We review all IT related acquisitions, including those that might be funded, that might be IT, might be IT within, for example, EHR modernization that is funded through a different appropriation, but it is something that we review and that is part of our coordinated understanding of IT across the enterprise. So I think it's important for us to make sure that we are coordinating and delivering IT at scale, that we are sourcing IT capabilities as an enterprise. There are cost advantages. There are cybersecurity advantages from that. There are advantages from a training and change management perspective. My general sense is that we are in pretty good shape as an agency, but of course, I'm less than 4 weeks into the job, and this is something that I'm aware of the importance and will be paying attention to while I'm in this seat.
I just wanted to state that I ask these questions because I feel that the transparency between VA and the subcommittee is imperative for us to move forward. I want to keep working together towards getting a better picture of the universe of VA's IT programs and the components so that we can perform adequate oversight and provide VA the funding it needs. With that, I yield back and I recognize Mr. Rosendale for 5 minutes.
Thank you, Mr. Chair. Dr. Evans, I've got a copy of the VA Digital Transformation Strategy here. Mm-hmm. Okay. I'm sure that even 4 weeks in, I'm sure you've seen it. And this is really easy to brand. Okay. 4, 5, 6, love it. Very nice. But what I'm trying to get into is it effective and is it accurate? Okay. So it's got 4 guiding principles, 5 imperatives, 6 focus areas on the website. And it looks like a IT bingo buzzword, that you've put together there. So what I would like to know now is that, are you going to keep that in place? Is that going to be the guiding principle? And if it is, then I want you to walk me through these issues and give me a little bit more description of them. Or do you have plans to update this and narrow your scope of focus and really drill down and make it a more basic document that's not all over the place?
Yeah. Well, first, I would say we need to continually reevaluate our strategy, and we do that. We regularly work with our customers because, frankly, our strategy and what should be driving our strategy are the needs of our customers. It should be what VHA is telling us they need, what VVA tells us they need, what NCA tells us they need, what other staff offices across VA tell us that they need, making sure we're delivering core infrastructure that supports the entire department, and most of all, supporting the experience of veterans who entrust us with their care. I agree that it is going to be important for us to speak with some clarity around the value that IT can bring to the table in transforming an agency, in transforming digital experience. And so in that sense, I intend to add to our digital transformation strategy some clarity of focus around what does it mean to deliver a better experience? What do we mean when we talk about customer service? To your point, right? What are each of these items on I think you referred to it as the bingo, the IT bingo chart? What do they mean, right? To me, customer service is, we, again, 6.2 million total tickets last year, 81% first contact resolution, average speed of answer of 55%. When it talks about strategic sourcing, more than 920 acquisitions reviewed by the CIO directly for $440 billion. of spend and making sure that we were reviewing those and thinking about how they fit together. That's the strategic sourcing mechanism. Secure interoperability. EHR modernization is a clear priority. So I could map what we're doing to that strategy, but I agree that we need to be able to tell that story of value. When we're making an investment in IT, are we delivering value to VHA, to VBA, to NCA, to the staff offices across our organization, and most importantly, to the veteran? And that is a story
And
that I
again,
hope will.
so really the summary, to summarize this thing, when you went over the first couple of questions and I said, okay, what are your goals? What is your strategy moving forward? And you described those to me. And then I said, okay, do you have a mandate from the secretary to go ahead and implement this? And you said, absolutely, yes. And okay, so when we talk about that strategy now, and then I look at this 2-page document, again, what I'm talking about is just the marketing end of it. Are we going to leave this document out there, which really is not going to be accurate, or are you going to be using this shotgun approach, to blast all over the place? And if not, are we going to, 406 is a big number in Montana, in case you didn't know. It's the only area code across the state. Really would be much more attractive to my clients.
All right. I completely understood. And I agree. Clarity of message of what we're trying to achieve is important.
So you'll be reviewing this. Can we expect you to review this transformation strategy, and we could expect some updates, or are you just going to take that document and build around it?
I will review that strategy, and you can expect updates.
Perfect. Love to see it. Thank you. Mr. Chair, I yield back.
Thank you, Mr. Rosendale. At this time, I'd like to recognize Chairman Takano for 5 minutes.
Thank you, Chairman Ravan. If I could, Dr. Evans, that question that I wanted answered about that I'm hanging, to what extent is VA dependent on contractors for staff augmentation? Would you say?
Within IT, I believe we have around 8,000 employees. I don't have the exact number, on board today, and approximately the same number of contractors for direct IT support.
So it's 50-50. You say 50% of your workforce is.
I can take it for the record to get you the exact numbers, but it's close to that.
All right. Well, thank you. The financial management business transformation program will replace a 35-year-old unsupported legacy system and will help VA meet federal financial regulations and address security vulnerabilities. Now, my staff has received encouraging updates regarding progress made with IFAMS and IFAMS implementation at VBA and NCA. However, I'm very concerned that this program's success will be stunted by the lack of progress with VA supply modernization and delays with EHRM. So the slow roll of the VA supply modernization and we've experienced delays with the EHRM, that the financial management business transformation, or FMBT, is going to be stunted because of that. What are you currently doing to help remedy issues that exist with interfacing with VA supply modernization program and EHRM?
So as you mentioned, FMBT has gone live in November of 2020 with NCA, and then there were 2 subsequent go lives in VBA in February of 2021 and May of 2021, with a plan for a further go live in support of NCA in April of 2022. There are interdependencies between supply chain and FMBT, particularly as we move towards VHA. I am working, frankly, to get up to speed on that. So it's hard for me to answer your question with the fidelity that I suspect you'd like.
Okay, well, I respect that. We'll take that for the record, and hopefully you'll get back to us on that, as well as how you plan to manage issues that will continue to occur with delays in the implementation of DIMLS, Logical, and EHRM. So, you know, I appreciate and applaud that you're willing to meet with us so early in your tenure, and we appreciate that you've taken on this role. It's a big one, and so if I may just you know, ask that we hear back from you, you know, on this issue. I've no further questions, Mr. Chairman. I'll yield back.
Thank you, Chairman Takano. At this time, I'd like to also thank the witnesses, especially under the 4 weeks of the initiation and being here with us today. And as acting secretary, we appreciate your candor. We appreciate your experiences as a physician and your services to veterans and your desire in order to make all of these systems work for veterans across the table in all services, financial, everything that's touched by technology. I would like to thank the witnesses for their participation today. I hope this hearing underscores how important I believe that the department's technology modernization efforts are and the department's continued progress in program management and acquisition, as well as a deeper commitment to cybersecurity. I look forward to continuing this conversation and hope that we begin to see some real progress in VA's effort to address these longstanding issues. All members will have 5 legislative days to revise and extend their remarks and include any extraneous materials. This hearing is now adjourned. Thank you.